Hi guys, welcome to the session of 100 one-liners. We are going to discuss important 100 one-liner questions of surgery. So let's start. Welcome Alia, welcome Muskan. So let's start. First, can you tell me what is the most common cause of bloody nipple discharge? Sanjay, welcome. Pragati, Sakir, Wahid, welcome. So can you tell me what is the most common cause of bloody nipple discharge, guys? Yes. Sravanti, Kodal, Dr. Parik, Sanjay, Vishnu Priya, good evening everyone. Tell me guys, first, what is the most common cause of bloody nipple discharge? So most common cause of bloody nipple discharge, yes, very good, it is duct papilloma. So what is the most common cause of bloody nipple discharge, guys? It is duct papilloma. Gaurav, absolutely correct. It is duct papilloma. Clear? It is duct papilloma. Duct papilloma. Alisha, Shikha, Nazia, everybody is correct. Next, pudy orange is due to involvement of its structure. Pudy orange in breast, it is because of involvement of its structure. Yes. Mehdi, Avinish, Jangit, very good. It is because of involvement of subdermal lymphatics. So pudy orange, it is because of involvement of subdermal lymphatics. It is because of involvement of subdermal lymphatics. Subdermal lymphatics. So it is because of involvement of subdermal lymphatics, right? Next question, which is very easy. Tell me guys, most common site of metastasis in both carcinoma breast and carcinoma prostate, it is same. Most common site of carcinoma breast, metastasis in carcinoma breast and carcinoma prostate, it is same. Yes, it is bone, and in bones which vertebra, very good, everybody is correct, it is lumbar vertebra. Ayush, very good. Muskan, it's lumbar vertebra. So most common site of metastasis, it is lumbar vertebra. So this is lumbar vertebra. Next question, most common organism responsible for breast abscess. Let me see who is going to reply. Easiest question, most common organism responsible for breast abscess. Lalit Yadav, Mehndi, Alisha, Unnati, Ayush, Vikram, very good. Yes, Avnish, Jangid, very good. Shikha, everybody is correct. It is Staph aureus. So that is Staph aureus. It is Staph aureus. Staph aureus. Next easy question. Treatment of choice for cystosarcoma phyllodes. Cystosarcoma is a type of sarcoma. Can you tell me treatment of choice? What we go for? Simple mastectomy or modified radical mastectomy? Which surgery should be done? Jency wants to say that, sir, is this 100 one-liner enough to pass FMG? Guys, you have to work hard. This is additional, obviously it will be helpful, but it is not enough. You have to revise the questions and you have to revise the stuff, right? So guys, everybody is correct, it is Staph aureus. So this is Staph aureus, treatment of choice for cystosarcoma phyllodes, that is Staph aureus. So that is Staph aureus, it is Staph aureus. Now see the next question. What is the most common solitary thyroid nodule? Easy question guys, tell me. Most common solitary thyroid nodule. Solitary thyroid nodule, most common, tell me. Yes, Pragati, Vikram Naidu, Shiva, Muralitharan, tell me most common solitary thyroid nodule. So the most common solitary thyroid nodule, yes, this is colloid goiter followed by follicular adenoma. So that's colloid goiter. It is colloid goiter followed by follicular adenoma. So guys, it is colloid goiter. So that is colloid goiter. So this is colloid goiter followed by follicular adenoma, adenoma. Next easy question, what is the most common location of thyroglossal cyst? Guys, tell me, easiest question. Most common location of thyroglossal cyst. Yes, Rupa, Shubdeep, Ayush, Avnish, Vaishnavi, everybody is correct. It is infrahyoid or subhyoid. So most common location of thyroglossal cyst, that is infrahyoid or subhyoid. So this is subhyoid. Next, what is the incision given for retrosternal goiter? We have to go for cervical incision or we have to go for thoracic incision? Tell me, cervical incision or thoracic incision? Yes, Shabdeep Singh, Avinash, Unnati, everybody is correct. Pradeep, Anupam, Banerjee and Shravant, Kodal, Rupa, Muskan, everybody is correct. Parik, yes, you are absolutely correct guys, because we have to ligate the vessels of thyroid in the neck. That's why cervical incision is preferred. So for retrosternal goiter, which incision? We have to go for cervical incision. So we go for cervical incision, Clear? Next, autoantibody in Hashimoto's thyroiditis. Every year you are going to get a question from Hashimoto's and Graves. Can you tell me guys, autoantibody? Everybody is correct. Alia, Vikram Naidu, Shubhadeep Singh, Avnish, Dr. Anonymous, Rupa, Vertigo, Vikram, Sakir. Yes guys, it is anti-TPO, anti-thyroid peroxidase. And you know that for Graves disease, what's the name of autoantibody? For Graves, it is LATS. You know that for Graves' disease it is LATS. LATS means long acting thyroid stimulator, and this LATS is against which receptor, guys? LATS, it is against TSH receptor. So LATS, it is against TSH receptor. Next question. Orphan NEI nuclei are seen in, everybody is correct already. Orphan NEI nuclei, guys, tell me. Orphan NE, all of you know that orphan NEI nuclei, it is seen in, yes, Muskan, very good, Alia, yes, Chetna, Vishnu, Sriraj, Rupa, Mehendi, Jensi, everybody is correct. It is papillary thyroid cancer or papillary carcinoma thyroid. So, this is papillary thyroid cancer. Next, easiest question, tell me, what is the most commonly injured nerve during thyroidectomy? Guys, tell me, most commonly injured nerve during thyroidectomy. Sunila, Vikram, Shikha, Thakur, yes, very good. Avinash, very good. Alia, Sakir, Gaurav Kumar, Ashiki, Lalit Yadav, Krishnakant, everybody is correct, guys. It is not recurrent laryngeal nerve. Remember, it is not recurrent laryngeal nerve. It is external branch of superior laryngeal nerve. So, it is not recurrent laryngeal nerve. This is external branch of, so this is external branch of superior laryngeal nerve. Clear? So, this is external branch of superior laryngeal nerve. Okay. Next, intraoperative thyrotoxic crisis is caused by, suppose a patient is having hyperthyroidism. Intraoperative thyrotoxic crisis is caused by, yes, very good, Ash Potato, good name, nice name, Shikha, Alia, Irfan Khan, Muskan, Sriraj, yes, poor handling. It's not poor handling, guys, it is pre-operative preparation. Inadequate pre-operative preparation means you didn't make this patient euthyroid. So, intraoperative thyrotoxic crisis, it is caused by inadequate pre-operative preparation. It's not the poor handling. So, that is inadequate, this is inadequate pre-operative preparation. Clear? So, this is inadequate pre-operative preparation. Easy? So, that is inadequate pre-operative preparation. So, intraoperative thyrotoxic crisis caused by inadequate preoperative preparation. Next, most common cause of primary hyperparathyroidism. Multiple times this question was asked. Primary hyperparathyroidism, guys, tell me, most common cause, yes, most common cause of primary hyperparathyroidism. All of you know, it is solitary adenoma, and it is in superior parathyroid or inferior parathyroid. It is located in superior parathyroid or inferior parathyroid. Yes, guys, superior or inferior, very good. Adenoma, Dr. Srini, Sriraj, Ashish, Dr. Marfin, Rupa, Mahmoodi Hassan, yes, it is inferior. Vishnu Priya, Muskan, everybody is correct. Most common cause of primary hyperparathyroidism, that is solitary adenoma, and this solitary adenoma in 80% cases located in inferior thyroid, inferior parathyroid. So, it is located in inferior parathyroid. It is in inferior parathyroid. Next, what is the most accurate modality for localization of parathyroid adenoma? And this was asked multiple times in INI-CET. On the 17th also of this month it was asked. Guys, tell me, cyst-amoeba scan. Avnish, Shrini, Vikram, Muskan, everybody is correct. Guys, it is cyst-amoeba. So, most accurate modality for localization of parathyroid adenoma, that is cyst-amoeba scan. This is cyst-amoeba scan. Next, what is the best test for diagnosis of pheochromocytoma? Let me see who is going to reply correctly. Rijwan, Shravati, Ashish Rajput, Sandalwood Adda, Shrini, Unnati Jain, very good. Bohra, Karthik. Okay. Guys, tell me what is the best test for diagnosis of pheochromocytoma? Very good. It is fractionated plasma metanephrines. And if I am going to ask the investigation of choice, that is 24 hours urinary catecholamines and VMA. So, what is the best test? It is fractionated plasma metanephrines. Remember, read the question carefully. So, this is fractionated plasma metanephrines. That is fractionated plasma metanephrines. Guys, remember this. Fractionated plasma metanephrines. And if the question is like this, what is the investigation of choice for diagnosis of pheochromocytoma? That is 24 hours urinary catecholamines and VMA. Thakur Arju Singh, welcome Thakur Sahab. Next, most common site of metastasis in older children having neuroblastoma. Guys, tell me, older children having neuroblastoma, what is the most common site of metastasis? Easy question. Guys, tell me, most common site of metastasis. Tell me. Muskan, Vishnu Priya, Shriti, very good. Everybody is correct, guys. It is long bones. So, in neuroblastoma, most common site of metastasis in older children, that is long bones, long bones. Next, easy question. Tell me, most common functional pancreatic neuroendocrine tumor in men 1, multiple endocrine neoplasia 1, most common functional pancreatic neuroendocrine tumor. Yes, Mohammad Miraj Alam, Hari Rio, Rupa correct, Muskan correct, it is gastrinoma. Yes, Shravati Kodali correct, it is gastrinoma followed by insulinoma guys. So, it is gastrinoma followed by insulinoma. So, this is gastrinoma, right. So, this is gastrinoma followed by insulinoma. So, that is gastrinoma followed by insulinoma. Clear? Now, see the next question. Next, very easy. Tell me, diagnosis of amoebic liver abscess is confirmed by. Tell me guys, diagnosis of amoebic liver abscess is confirmed by. Yes, easy question. Tell me guys, diagnosis is confirmed by. Diagnosis of amoebic liver abscess, Muskan, very good. Most of the times you are correct, Muskan. Vishnu, Sriraj, it is not CT. It is not CT. Gaurav Kumar, it is not ultrasound. Yes, majority of you are correct. Akash, Mohammudi Hassan, Parik, Kaur, K, Vikram Naidu, Dr. Philadelphia, Siva, everybody is correct guys, because it's parasitic infection or infestation. So, here there is formation of antibodies. So, we are going to detect antibodies by serology. So, diagnosis is confirmed by serology. This is amoebic serology by ELISA. So, diagnosis is confirmed by serology and it is amoebic serology by ELISA. Next, what is the most preferred method for anatomically and surgically appropriate hydatid cyst? You know, most preferred method guys, tell me. Most preferred method, yes, Alia, Sriraj, Vishnupriya, Muskan, Shristi, Mangla, Unnati Jain, everybody is correct guys, it's spare, it's puncture, aspiration of content, instillation of scolicidal agent and reaspiration. And can you tell me what is the most effective treatment for hydatid cyst and most effective treatment, that is pericystectomy, most radical treatment, that is hepatic resection. So, here correct answer is pair. Next question, what is the most common malignancy of liver? Easiest question. Very good. Shravanti Kodali, it is metastasis. Alia, it is metastasis. So, all of you know that most common malignancy of liver, that is metastasis, and most common primary malignancy of liver, that is hepatocellular carcinoma. Next, benign liver tumor. Guys, see, it's very easy and important. Benign liver tumor with central stellate scar and spoke wheel appearance. Spoke wheel appearance or cartwheel appearance, central stellate scar. It is seen in which tumor? Very good. Chetna Vishwas, very good Chetna. Alia, very good. Sunila, Ashish Potato, Ash Potato, Science-O-Fi, Rahul, Son Anonymous, Kanupriya Sani, Ramya, everybody is correct. It is focal nodular hyperplasia. So, here you are going to find central stellate scar with spoke wheel or cartwheel appearance, that is focal nodular hyperplasia. Next question guys, liver tumor with raised neurotensin, very important, raised neurotensin and vitamin B12 binding globulin. Tell me, which tumor? Vikram Naidu, very good. Hari Rio, NHB04, very good guys. Raised neurotensin and vitamin B12 binding globulin. Which tumor? Very good Muskan, Subhadeep, Sriraj, it is fibrolamellar variant of HCC. So, which variant? You know, it is fibrolamellar. Name, this is fibrolamellar variant of HCC. Clear guys? So, it is fibrolamellar variant of HCC. Fibrolamellar variant of HCC. Easy. Next, what is the investigation of choice for diagnosis of hepatoblastoma? Let me see who is going to reply this question correctly. Investigation of choice for diagnosis of hepatoblastoma. Tell me guys. Sunila, K, very good Chetna, Vishnu Priya, Ashish, Muskan, Tanay, Bargaonkar, Vikram Naidu, Dr. S.K. Chaudhary, everybody is correct guys. In children we have to go for biopsy. So, it is biopsy, and if the question is asked what is radiological investigation of choice for hepatoblastoma, it is CCT, but investigation of choice, that is biopsy. Next, liver segment spared in Budd-Chiari syndrome caused by hepatic vein thrombosis. Easiest question. Easiest question, the liver segment spared in Budd-Chiari syndrome caused by hepatic vein thrombosis. Guys, tell me. Yes, Dr. Devnath, very good, very good. Vikram Naidu, very good. Ketan Priya, yes. Hari Rao, very good. So, all of you are correct guys, all of you are correct. So, all of you are correct guys, all of you are correct. Clear? So, this is what? This is caudate lobe. So, you know, this is caudate lobe. So, this is caudate lobe, caudate lobe. Yes, everybody is correct. After that, see this question, creatinine, bilirubin and INR, these are the components of, easiest question guys, tell me. The mnemonic, I am going to tell you, it is CBI, creatinine, bilirubin and INR, these are the components of, tell me guys, easy. Yes, very good. Twak, Muskan, Shikha Srivastav, everybody is correct, right guys? So obviously it is MELD score, and can you tell me what is the full form of MELD score? This is model for end stage liver disease. So this is MELD score and this is model for end stage liver disease, clear? Next, most common complication of insertion of Sengstecken Blackmore tube, easiest question. Most common complication of insertion of Sengstecken Blackmore tube. Yes, Sengstecken Blackmore tube. Tell me guys, most common complication. Yes, Ashish Rajput, Muskan, Vishnupriya, everybody is correct guys. Yes, Rupa, very good. Shubhadeep, Shravanti, see aspiration. That's why before insertion of Sengstecken Blackmore tube, what should be protected? Airway should be protected. So the most common complication of insertion of Sengstecken Blackmore tube, this is aspiration. This is aspiration. Aspiration. Next, what is the most common complication of TIPS? Transjugular intrahepatic portosystemic shunt. TIPS, most common complication guys, waiting for your reply. Tell me. Yes, Kanupriya, it's not perforation. Avinash, very good Avinash, you are correct. Very good. Muskan, Avnish Rajput, Kaur, yes, Dr. Dikshit, all of you are correct guys, it is encephalopathy. So most common complication of TIPS, that is encephalopathy. This is encephalopathy. It is encephalopathy. Next, very easy question. Tell me what is the preferred vein for insertion of peritoneal venous shunt? Preferred vein for insertion of peritoneal venous shunt. For peritoneal venous shunt, what is the preferred vein? Easy question. Yes, inferior vena cava or superior vena cava synophy. It is not inferior or superior vena cava. Tell me the most preferred one. It is right internal jugular vein. Very good. Abhiroot Banyana, Abhiroot Rijwan, Twek, Hari Rao, Unnati Jain, Alisha, Rahul Son. It is right internal jugular vein. So guys, you are correct. It is right internal jugular vein followed by superior vena cava. This was asked in INI-CET. So it is right internal jugular vein followed by superior vena cava. Next, what is the most common cause of pre-sinusoidal intrahepatic portal hypertension? Pre-sinusoidal intrahepatic portal hypertension. Guys, tell me. Shubhadeep, Kanupriya, Alisha. Most common cause of pre-sinusoidal intrahepatic portal hypertension. Muskan, Kaur, very good. Hari Rio, Vishnupriya, all of you are correct guys. What is this? This is cystosomiasis. So what? It is Bohra, Kartik, Vikram, Rijwan, Tweak, Rupa, cystosomiasis. So guys, this is cystosomiasis. Easy? Cystosomiasis. Next question. Cholesterol gallstones are made up of. This was asked in NEET PG. Tell me, what is the composition of cholesterol gallstone? Gaurav, tell me. Composition of cholesterol gallstone. Guys, tell me. I am waiting for your reply. Yes, let me see who is going to reply correctly. First person to reply correctly, Muskan. Muskan, you are absolutely correct. It is crystalline cholesterol monohydrate. Dikshit, you are also correct. So this is crystalline cholesterol monohydrate. So guys, this is crystalline cholesterol monohydrate. Crystalline cholesterol monohydrate, right? So this is crystalline cholesterol monohydrate. Monohydrate. Tanay, Unnati, Thakur, Arjun Singh, Bothra, everybody is correct. Nitya, Subhadeep, everybody is correct. Next, tell me, what is the most common type of gallstone? Let me see who is going to reply correctly. First person to reply correctly, Anshika Goel. Anshika, you are correct. It is mixed. Suppose mixed is not given in the option. In that case, what will you mark? You are going to mark cholesterol. So if mixed is not given in the option, mark cholesterol. Mixed not given in the option, then mark cholesterol gallstone. Next, what is the gold standard investigation for diagnosis of acute cholecystitis? Gold standard. Guys, tell me. I will, see who is going to reply first. First person to reply correctly, Dr. Dikshit. Dr. Dikshit, you are correct. This is HIDA scan. Can you tell me the full form of HIDA scan? It is hepatobiliary immunodiacetic acid scan. And what is the diagnostic criteria? It is non-visualization of gallbladder. So HIDA scan, that's the gold standard investigation. Next, what is the most common site of fistula in gallstone ileus? Guys, tell me. Most common site of fistula in gallstone ileus. Gallstone ileus. Obviously, it's between gallbladder and which organ? Yes. Which organ? Very good. It is cholecystoduodenal. Alakesh Kaushik. First person to reply correctly, Alakesh Kaushik. So this is cholecystoduodenal. Cholecystoduodenal. It is cholecystoduodenal. Rest of the you are also correct. So it is cholecystoduodenal fistula. Gaurav, Anshika, Dr. Srini, you are correct. So cholecystoduodenal fistula. Guys, next question. Diamond ring sign, cometal artifacts on ultrasound is seen in. Diamond ring sign. Comet tail artifacts on ultrasound is seen in which condition? Tweak, anonymous, Ansika, Dr. Shini, tell me. Easiest question, first person to reply correctly Muskan, and second is Shubh, third is NHBO4. Yes, so it is adenomyomatosis. Here guys, it is adenomyomatosis. Clear? So this is adenomyomatosis. Next question, number of regional lymph node involved in N1. In carcinoma gallbladder, there is TNM staging, which is important. You have to remember TNM staging at least for carcinoma gallbladder and CA breast at least, and you have to remember 5. If you can't at least 2, minimum 5. Minimum 5 means CA breast, carcinoma gallbladder, stomach, colorectal and oral cavity. So guys, it is up to 1 to 3. So 1 to 3 lymph node. So what is N1? Whenever there is involvement of lymph node, number is 1 to 3 and N2 is 4 or more. Next question, which organ is having maximum absorptive capacity per unit surface area? Guys, tell me, it is gallbladder or jejunum? Which organ is having maximum absorptive capacity per unit surface area? Muskan, again you are correct. Abhiroot, it is not jejunum. Sinophyte is not jejunum. Guys, it is not jejunum. Maximum absorptive capacity is seen in jejunum, but maximum absorptive capacity per unit surface area, this is seen in gallbladder. So here the correct answer is gallbladder. Remember, maximum absorptive capacity, jejunum. But if it is asked that maximum absorptive capacity per unit surface area, then the correct answer is gallbladder. Very good. Next question guys, tell me, what is the most common choledochal cyst? Let me give you the hint. In majority of classification system, you are going to notice that the most common type is type 1. And if type 1 starts with A, B, C, D, E, classification starts with A, B, C, D, E, then the most common type is A. So can you tell me what is the most common type of choledochal cyst? It's type 1. And in type 1, it is further divided into 1A, 1B, 1C. Now guys, tell me what is the most common type? 1A, 1B, 1C. So everybody, Alisha, Rupa, Anonymous, Gaurav, all of you are correct guys. It is 1A which is most common. So overall, if you see, the most common is type 1, followed by type 4, followed by type 3. And guys, how to remember? Can you see? It is 143, and you know the meaning of 143. You must be knowing the meaning of 143. So it's type 1, followed by type 4, followed by type 3. Clear? And in type 1, the most common type is 1A. Clear? Next, very good. Brunda N and Dr. Binola, very good. Now, can you tell me maximum size of CBD stone removed by ERCP? Guys, tell me maximum size. Abhiroot, Bhayana, it's not 2.5 centimeter guys. It's not 2.5. Vishnu Priya, very good, very good. Muskan, yes. Raun, NH, Dr. AK, Chetna, very good. Majority of you are correct guys. Majority guys, it is 1.5 centimeter. Let me tell you, for ESWL it is 2 centimeter. ESWL for kidney stone 2 centimeter. ERCP for CBD stone 1.5 centimeter. So remember, it is 1.5 centimeter. So this is 1.5. Next, Reynolds pentad. Tell me, easiest question. It is Charcot striate plus. Reynolds pentad, that is Charcot striate plus. It is Charcot striate plus. Very good. First person to reply correctly, Avinash Jangid, and second, Syed Mudassir Mustafa Shah. Very good. Third, Shubhadeep Singh. So guys, it is shock plus altered mental status. So that is shock plus altered mental status. Easy. So this is shock plus altered mental status. Altered mental status. Easy. Right. Next question. According to Bismuth classification, hilar stricture with intact confluence. Bismuth classification. Type 1. Common hepatic duct stump more than 2.5, type 2 less than 2.5. Guys, can you see? It is type 3. Avinash, correct. Muskan, Vishnu Priya, Ashish, Shravanti, all of you are correct guys. It is type 3. This is type 3. And whenever there is hilar stricture with destroyed confluence, that is type 4. Clear? So it is type 3. Next, prune tree appearance on cholangiography. Tell me guys, prune tree appearance in which there is selective destruction of intrahepatic, terminal intrahepatic branches. Prune tree appearance. Tell me guys, prune tree. Waiting for your reply. Let me see who is going to reply correctly. Yes, first person to reply correctly is Muskan. Second person is Vishnu Priya. So guys, it is primary sclerosing cholangitis. This is primary sclerosing cholangitis, prune tree appearance on cholangiography. Next, pruritus precedes jaundice. In which condition? Next question, let me see who is going to reply correctly. Pruritus precedes jaundice. In which condition? In most of the condition, first jaundice comes, after that there is pruritus. But here, pruritus precedes jaundice, and first person to reply correctly Ashish, second is Muskan, and third is Charan Polar. Charan Polur. So guys, it is primary biliary cirrhosis. Primary biliary cirrhosis. Next question, hilar cholangiocarcinoma. Easiest question. What is the other name? Hilar cholangiocarcinoma is also known as, yes, Nityashri Ranjan Sahni, hilar cholangiocarcinoma. First person to reply. Anna wants to ask that, sir, do RR is enough for FMG? Guys, see, now the time is not enough for main videos. So if you have done main videos, you can revise it, you can go through the notes. But if you haven't done main videos, if you are going to start now, then obviously you have to go for RR minimum rapid revision आपको करना है अगर आप अभी start कर रहे हैं. But if you have started a bit early, आपने देख लिया है सारा मेन वीडियोस, देन गो थ्रू द मेन वीडियोस, राइट. लास्ट में रिवाइज कर लीजिए रैपिड रिवीजन से. लेकिन अगर आप अभी स्टार्ट करें तो ऑब्वियसली यू आर नॉट हैविंग टाइम, सो गो थ्रू रैपिड रिवीजन multiple times, and approximately 80% question, 75 to 80% question will be from surgery rapid revision. Okay, clear? So guys, tell me, hilar cholangiocarcinoma, all of you told me that it is known as Klatskin tumor. So this is Klatskin tumor. This is Klatskin tumor. Clear? So this is Klatskin tumor, guys. Okay, Klatskin tumor. Next, you can see the next question, most common congenital anomaly of pancreas. Guys, most common congenital anomaly of pancreas, tell me. First person to reply correctly. Imran wants to ask, sir, will NEET PG be postponed? Any speculation? See, if the date has been changed, right? See, it's my opinion only, because initially it was supposed to be conducted in 2 shift. अभी order आ गया कि नहीं एक shift में कराना है. So NEET board means MCI has to make the arrangements. So it's my personal opinion. हो सकता है postpone हो जाए, but guys you should think that it is not getting postponed. तो आपको 15 जून को ही मान के चलना है. Keep revising, keep studying. अगर postpone होता है, yes, it's an opportunity. तो वो अपॉर्चुनिटी आप यूटिलाइज करेंगे. अभी आप मान के चलेंगे दैट इट इज ऑन 15th ओनली, राइट. सो नो स्पेक्यूलेशंस गाइज. सो मोस्ट कॉमन कंजेनाइटल एनॉमली, वेरी गुड इमरान. ओके, सो दिस इज पैनक्रियाज डिविजन गाइज, दिस इज पैनक्रियाज डिविजन. Pancreas division. Next, treatment of choice for annular pancreas. So in annular pancreas, tell me, Thakur Arjun Singh, very good. Thakur, tell me, treatment of choice for annular pancreas. Guys, tell me. Yes, first person to reply correctly, Chetna Vishwas. Second person, Dr. Anonymous. Guys, it is DD. DD means duodenal-duodenostomy, followed by DJ. DJ means duodenal-jejunostomy. So it is DD followed by DJ. Next, most common cause of death in acute pancreatitis within 2 weeks of hospitalization. Acute pancreatitis within 2 weeks of hospitalization. What is the most common cause of death? Let me see who is going to reply correctly. Yes, Muskan first person, Anonymous second person, Ashish third, Vishnupriya fourth. Now everybody is correct. Guys, it is MODS, multi-organ dysfunction syndrome, and if it is occurring after 2 weeks, it is because of sepsis. Next question, investigation of choice for diagnosis of acute pancreatitis. Shiva, very good. Tell me, investigation of choice for diagnosis of acute pancreatitis. It is not ultrasound, Sriraj, it is not ultrasound. Ashish Rajput, Muskan, yes, both of you are correct. It is CCT. So investigation of choice for diagnosis, that is CCT. So guys, it is CCT. Clear? Next, in Bishop score, blood urea nitrogen should be how much? Tell me the value. In Bishop score, blood urea nitrogen value should be, yes, Megha, Ahir, Rupa, Nityasri. Now the second question, first person to reply correctly is Shubh, second is Muskan, third Charan Polur. Yes, it should be more than 25 milligram per deciliter. So guys, it is more than 25 milligram per deciliter. Next, SIRS, systemic inflammatory response syndrome. Can you tell me the heart rate? Heart rate should be more than, Gauri Chelladuri K, heart rate should be, Chetan Vishwas, Chetna Vishwas, Anuj, Shubhadeep Singh, all of you are correct guys. It should be more than 90. Vishnupriya, very good. Sanjana, so it should be more than 90 per minute. More than 90 per minute. Next, in Q SOFA, the respiratory rate should be, Q SOFA, respiratory rate, Q SOFA quick sequential organ failure assessment, respiratory rate should be, guys, respiratory rate should be more than equal to 22. Dikshit, very good. Chetna, very good. So it should be more than equal to 22 per minute. So how to remember guys, Q SOFA, mnemonic is QRSMS. So, it is QRS-MS. Q means Q-SOFA, R means respiratory rate more than equal to 22 per minute, S that is systolic blood pressure less than equal to 100 mmHg, and MS that is mental status alteration. Next, easiest question, what is the gold standard investigation? So, guys, what is the gold standard investigation for chronic pancreatitis? Easy question, guys. You know that investigation of choice is MRCP, but the gold standard investigation, that is ERCP. Everybody is correct. Ranjan Sahni, very good. Pratiksha Patel, everybody is correct, guys. It is ERCP. Investigation of choices MRCP, but the gold standard is ERCP. Next question. Central sunburst calcification on CET is seen in. Easiest question. Multiple times it was asked in radiology. Central sunburst calcification. Guys, tell me. Central sunburst calcification on CCT. Let me see. First person to reply is Muskan. Second person is Vishnupriya. Third is Shravanti Kohli. Guys, it is serous cystic adenoma. So, serous cyst adenoma or serous cystic neoplasm. So, that is serous cystic neoplasm, also known as serous cyst adenoma. Next, both amylase and CEA are raised in cystic neoplasm. What is the name? Both amylase as well as CEA, both of these are raised in. Guys, let me see who is going to reply first. First person is Shubh, second person is Shravanti, third person is Shabdeep. So, it is IPMN. Guys, tell me the full form. It is intraductal papillary mucinous neoplasm. So, that is IPMN. Next, what is the most common gene mutation in carcinoma pancreas? Kaur, Rupa, Sanjana, Dr. Hari, tell me. What is the most common gene mutation in carcinoma pancreas? Very good. First person to reply correctly is Shravanti, second is Muskan, third is Vishnupriya. Guys, it is KRAS followed by P16. So, this is KRAS followed by P16. Next, waxing and waning of jaundice with melena is seen in which malignancy? Waxing and waning of jaundice with melena is seen in which malignancy? Let me see. First person to reply correctly. Yes, first person Muskan, second is Shravanti, third is Muskan, very good Muskan, third is Shravanti, and third is Hari, Dr. Hari Rio. So, guys, it is ampullary carcinoma, and you know ampullary carcinoma is a type of periampullary carcinoma. So, here the correct answer is it's ampullary. The correct answer is it's ampullary carcinoma. Clear? So, this is ampullary carcinoma. Clear? Next. Next, you can see most common complication of pancreaticoduodenectomy or Whipple's procedure. Easiest question, and it was asked multiple times. Whipple's procedure or pancreaticoduodenectomy, most common complication. Gaurav Kumar, very good. Tell me, Gaurav, you tell me. First person to reply correctly, Muskan. Second is Vishnupriya. Most of the times, Muskan. Chelsea Rathod. Fourth, Dr. Hari Rio. Guys, it is delayed gastric emptying. So, most common complication is DGE. What is DGE? This is delayed gastric emptying. Next easy question, gold standard investigation for diagnosis of insulinoma. Insulinoma, what is the gold standard investigation for diagnosis? Tell me, guys, gold standard. Let me see who is going to reply correctly. First person I am waiting for. First person is Shravanti Kodali. Shravanti, second is Muskan, third is Vishnupriya. Very good. Dr. Anonymous, guys, it is 72 hours fasting. So, the gold standard is 72 hours fasting. Next question, which is easy question. You know that gastrinoma is located in gastrinoma triangle, that is triangle of Passaro. So, can you tell me what is the most common site? Exactly, what is the most common site, guys? Most common site. Yes. First person to reply, Dr. Anonymous, second is Shubh, third is Vishnupriya, fourth is Shravanti. It is duodenum. And which part of duodenum, can you tell me? So, most common site, it is duodenum followed by pancreas. So, this is duodenum followed by pancreas, and guys, tell me which part of duodenum? It is D1 first part, followed by D2 second part, followed by D3 third part, and it is not seen in fourth part. This was asked in FMGE exam, and they asked what is the most common site of gastrinoma in men 1? In men 1 also the most common site is same, duodenum. Clear? Guys, next easy question, what is the most common symptom of glucagonoma? Most common symptom of glucagonoma, tell me, most common symptom of glucagonoma. Yes, tell me. First person to reply correctly, I am waiting for, guys. First person is Shravanti, second is Muskan, and third is Vishnupriya. Guys, it is necrolytic erythema migrans. So, most common symptom, that is NEM. that is NEM. This is necrolytic erythema migrans, and you know that glucagonoma is also known as 4D syndrome, diabetes, dermatitis, DVT, depression. So, here there is necrolytic erythema migrans, that is the most common symptom. Next question, what is the location of defect in Bok-Dalek hernia? Easiest question, tell me the answer. What is the location of defect in Bok-Dalek hernia? Guys, I am waiting for your reply. Yes, very good. First person is Shravanti. Yes, it is posterolateral, left posterolateral. So, it is left posterolateral. It is left posterolateral, left posterolateral, left posterolateral, and guys, you know how to remember, it is BPL. So, it is left posterolateral, it is Bok-Dalek posterolateral. So, it is below poverty line BPL. So, Bok-Dalek posterolateral. So, it is left posterolateral. Next, investigation of choice for diagnosis of GERD, gastroesophageal reflux disease. Investigation of choice for diagnosis of GERD. Guys, tell me. Endoscopy, very good Avinash. It is endoscopy, and if the question is asked gold standard investigation is 24 hours pH monitoring. So, investigation of choice is endoscopy, gold standard is 24 hours pH monitoring. So, here investigation of choice, that is endoscopy. Endoscopy is investigation of choice and gold standard is 24 hours pH monitoring. Okay. Next easy question, bird beak appearance, pencil tip appearance on barium swallow. It is seen in which condition? Bird beak, pencil tip. Bird beak, pencil tip. First person to reply correctly, Imran. Imran. Now, everybody is marking correctly, all of you know guys, and let me tell you, every year you are getting one question from esophagus, either Zenkus diverticulum or you are getting achalasia cardia or diffuse esophageal spasm every year. So, this is achalasia cardia. So, what is the correct answer here? This is achalasia cardia, achalasia cardia. Next, corkscrew or rosary bead appearance on barium swallow. Corkscrew, Avinash, again you are correct. Aryan, very good Aryan. Ash potato, very good. Now, everybody is correct guys, it is DES, that is diffuse esophageal spasm. So, corkscrew or rosary bead appearance, it is seen in DES, that is diffuse esophageal spasm. Clear? Next question, tell me, what is the most common symptom of Zenkus diverticulum? The symptom is same in achalasia cardia also and Zenkus diverticulum also. Tell me guys, most common symptom. Suneha Thippeswamy, Suneha, very good Suneha. Tell me, most common symptom, Vishnupriya, Muskan, Shravanti, Sakir, Wajid. Yes guys, it is dysphagia. So, the most common symptom of Zenkus diverticulum as well as achalasia cardia, what? It is dysphagia. This is dysphagia. This is dysphagia. Next question, what is the investigation of choice for staging? Staging of carcinoma esophagus and carcinoma stomach. Let me tell you the clue. In GI malignancy, staging is mainly based on one parameter, and that is mainly what? Depth of invasion. So, staging is mainly dependent on depth of invasion. Guys, now can you tell me what is the correct answer here? Very good Shravanti, very good. Ranjan, Shahni, Megha, Ahir. Yes guys, most of you are correct, but all of you are not correct. Guys, it is endoscopic ultrasound, it is not PET CT, it is endoscopic ultrasound, because easily you can assess the depth of invasion. So, that is endoscopic ultrasound. Next, what is the best conduit after esophagectomy for carcinoma esophagus? Best conduit after esophagectomy for carcinoma esophagus guys? Yes, everybody is correct. Vishnupriya, Sri Raj, Shravanti, Kodali, NASA, Edge, Anupam. Yes guys, it is stomach followed by left colon followed by jejunum. So, best conduit is stomach. Suppose stomach is unhealthy, so second option is left colon, it is left colon. Suppose it is also unhealthy, then we choose jejunum. So, third option is jejunum. So, best is stomach followed by left colon followed by jejunum. Next easiest question, macular striate. What is macular striate? Thoracic pain, vomiting, cervical subcutaneous emphysema. It is positive in which condition? Yes, very good guys, very good. First person is Subhadeep Singh, second is Rupa, third is Muskan. It is positive in Boerhaave syndrome. So, this is positive in Boerhaave syndrome. So, it is positive in Boerhaave syndrome. Boerhaave syndrome, easy. Now, see the next question. Treatment of choice for chronic or intractable duodenal ulcer. Let me see who is the genius over here. Treatment of choice for chronic or intractable duodenal ulcer. Yes, Guys, tell me it's not PPI, guys. It's not PPI. First person is Muskan. Second person is Dr. Anonymous. Third person is Vishnu Priya. Fourth, Akash. Guys, it is highly selective vagotomy. So, for chronic or intractable duodenal ulcer, we go for highly selective, and if it is recurrent duodenal ulcer, for that we go for truncal vagotomy. Easy? So, recurrent truncal vagotomy. Next, what is the most common metabolic complication after gastrectomy? Tell me, guys. This was asked multiple times. Let me see who is the genius over here. Yes, very good. First person is Shravanti, second is Shubhadeep, third is Vishnu Priya, fourth Abhirut Bhayana. So, guys, it is iron deficiency anemia followed by what? Megaloblastic anemia. So, it is iron deficiency anemia. When more than 50% stomach is removed, then only patient is going to develop megaloblastic anemia because of impaired absorption of B12. Next, according to Forest classification, non-bleeding visible ulcer. So, active pulsatile bleeding 1A, oozing 1B, non-bleeding visible vessel. Guys, tell me what is this non-bleeding visible vessel? First person to reply correctly is Ranjan Sahni, second is Shubh, third is Shravanti, fourth is Anuj. So, guys, it is 2A. This is what? This is 2A. Next, most common artery responsible for bleeding in Mallory-Weiss syndrome. Be careful, it is not duodenal ulcer, it is Mallory-Weiss syndrome. Tell me, first person is Avinash, second person is Abhirut, third is Shubhadeep Singh. Guys, it is left gastric artery. And suppose question is asked, what is the most common artery responsible for bleeding duodenal ulcer? Then it is gastroduodenal artery. So, here it is left gastric artery. This is left gastric artery. Next question, investigation of choice for diagnosis of watermelon stomach. Tell me, guys, for watermelon stomach, what is the investigation of choice for diagnosis? Watermelon stomach. Let me see who is going to reply correctly. Yes, first person is Vishnu Priya. Guys, it is not only endoscopy, we go for endoscopy plus biopsy because there is vascular ectasia, we have to confirm the diagnosis. So, it is endoscopy. Apart from endoscopy, what else is done? We go for biopsy. So, it is endoscopy plus biopsy. Next, what is the most common route of spread in Crookenberg tumor? You know that whenever there is involvement of bilateral ovary in carcinoma stomach, this is Crookenberg tumor. What is the most common route of spread? Yes, it is not hematogenous, guys. It is not. Let me tell you, let me see. Till now, nobody marked the answer correctly. Till now. First person is Kaur, who replied it correctly. It is retrograde lymphatic. So, this is not hematogenous, it is retrograde. So, guys, this is retrograde lymphatic, clear? So, this is retrograde lymphatic, okay. So, this is retrograde lymphatic, that is clear, okay. Next, can you tell me what is the drug of choice for unresectable GIST? Gastrointestinal tumor which is unresectable. First person to reply correctly is Chetna, second is Abhirut, third is Rupa. So, guys, it is imatinib, and you know the second line is sunitinib and the third line is regorafenib. Next, what is the dyselectrolytemia in IHBS? Infantile hypertrophic pyloric stenosis. Guys, tell me dyselectrolytemia. So, all of you know that there is hypochloremia, hypokalemia, metabolic alkalosis with paradoxical aciduria. So, here there is hypochloremia, hypokalemia, metabolic alkalosis. So, hypochloremia, hypokalemia, metabolic alkalosis with paradoxical aciduria. Metabolic alkalosis with paradoxical aciduria, okay, paradoxical aciduria. Let me tell you the predictable question in the FMG exam. Let me predict the questions. Guys, in breast, we are expecting that there will be one question related to staging, and the staging will be T4B or T4D most probably. We are expecting a question about breast cancer staging. Second question we are expecting is about breast abscess. So, one is breast cancer staging and management. Second question is related to breast abscess. In thyroid, the classical question is papillary carcinoma thyroid, that FNAC image. In thyroid, another question we are expecting related to complications of thyroid, and two questions are expected related to what? Hashimoto's and Graves. Okay. So, thyroid, parathyroid in thyroid and breast. In parathyroid and adrenal, we are expecting a question related to MEN syndrome, either MEN 1, MEN 2A, MEN 2B. I am telling you. Next is liver. In liver, either question will be there in relation to liver abscess, hydrated cyst, or sometimes liver tumor. After that, in gallbladder, staging is most important. So, one question will be related to stone or carcinoma gallbladder. In bile duct, cholangiocarcinoma is hot topic nowadays, hemophilia is hot topic nowadays. In pancreas, acute pancreatitis, chronic pancreatitis, carcinoma pancreas, and especially neuroendocrine tumors of pancreas, insulinoma and glucagonoma, gastrinoma, these are hot topics. Okay. In esophagus, there will be a coin. On X-ray, there will be a coin. So, this question is trending. Bogdalek hernia, this question is trending, or we can get a question related to image based question, Zenker's diverticulum, achalasia cardia, and DES. So, these are expected question, and let me tell you 3 tumors which are most important questions. 3 tumors: carcinoid tumor, GIST, pheochromocytoma. Every year in each and every paper, at least one question is there. GIST, pheochromocytoma and carcinoid tumor. So, guys, these are hot topics. I will keep repeating the hot topics here. Dyselectrolytemia means gastric outlet obstruction, infantile hypertrophic pyloric stenosis. This is one of the most commonly asked question. They ask dyselectrolytemia क्या होता है? So, this is one of the important question. Okay. Next, what is the most common site of stress ulcer, guys? Tell me. Most common site of stress ulcer. Yes, stress gastritis or stress ulcer. Guys, for NEET PG also, see, these are the predictable topics क्योंकि NEET PG FMGE का conducting body same है. That's why you can see that the topics are almost similar. So, most common site of stress ulcer, guys, it is fundus. So, it is in stomach, fundus, followed by body, followed by antrum, followed by pylorus. So, fundus followed by body, followed by antrum, followed by pylorus. Okay. Next question, diagnostic criteria of SBP. This is again an important question. ये कई बार आ चुका है. Spontaneous bacterial peritonitis. So, this is also a predictable question, right? So, what is the diagnostic criteria? Very good. Muscan, neutrophils more than 250, and there should be monomicrobial growth. So, diagnostic criteria, neutrophils more than 250, and monomicrobial growth. Yes, this is also a predictable question. कई बार आ चुका है. Multiple times this was asked in both NEET PG and FMG. After that, what is the treatment of choice for perforation peritonitis? Let me tell you what kind of question they are asking. They give you one chest X-ray with free gas under right dome of diaphragm, and after that they will ask you the management. So, what you give? IV fluids followed by exploratory laparotomy. So, here fluid followed by exploratory laparotomy. Clear? So, Vishnu, Muskan, Shubh, Megha, Ahir, all of you are correct, guys. So, first resuscitate the patient. So, IV fluids followed by exploratory laparotomy. So, it is IV fluids followed by exploratory laparotomy. Okay. Next, what is the most common site of intraperitoneal abscess? Tell me, guys. Very good. Intraperitoneal abscess, most common site, it is pelvis. So, it is pelvis. Overall, the most common site is pelvis. This is pelvis. Next, there is a triad which is positive for mesenteric cyst. Guys, can you tell me the name? What is the name of triad? Megha, tell me. Sujana, yes, first person to reply. It is Shravanti, Kodali, Vishnu, Muskan, Kaur, anonymous. Guys, it is Tilox triad. This is Tilox triad. So, this is the triad of mesenteric cyst, Tilox triad. Okay. Now, see the next question. What is the most common cause of large bowel obstruction? Guys, tell me. Easiest question. What is the most common cause of large bowel obstruction? Let me give you the hint. Adhesions or malignancy? It is adhesions or malignancy. Yes, it is obviously Muskan. Very good, you are correct. Muskan, Shravanti, Vishnupriya, guys, all of you are correct. It is malignancy. And most common cause of small bowel obstruction, that is adhesions. Clear? Next, claw sign. I am telling you, this question is also expected in the exam. There will be image based question. Barium enema will be given, claw sign or coiled spring sign. So, barium enema, claw sign or coiled spring sign will be given. Guys, tell me, it is seen in which condition? Intussusception. Everybody is correct. So, this is intussusception. Another question which is expected, coffee bean sign and bent inner tube sign on X-ray. Coffee bean, bent inner tube. Let me see who is going to reply correctly. This is easiest. Vishnu Priya, very good Vishnu. Shubh, you are correct. It is seen in sigmoid volvulus. And guys, you know that kidney bean, it is seen in cecal volvulus. So, this is sigmoid volvulus, and kidney bean, that is seen in cecal volvulus. Next, what is the most common ectopic mucosa in Meckel's diverticulum? Most common ectopic mucosa in Meckel's diverticulum. Yes. So, that is gastric followed by pancreatic followed by colonic. It is a famous question, remember GPC. So, it is gastric followed by pancreatic followed by colonic, clear. So, guys, it is gastric followed by pancreatic followed by colonic. So, gastric followed by pancreatic followed by colonic, easy. Next question, thickened, and let me see who is the genius over here, because this question was asked in NEET PG previously. Thickened and petulous IC valve and narrow terminal ileum on barium meal follow through in GITB is known as. Very good. First person to reply Shravanti, second is Abhirut, third is Vishnupriya, fourth Muskan, and anonymous, guys, it is known as Fleischner sign. So, Fleischner sign also known as inverted umbrella sign. So, what is the name? This is known as Fleischner sign. So, this is known as Fleischner sign, also known as inverted umbrella sign. So, Fleischner sign also known as inverted umbrella sign, clear. So, Fleischner sign also known as inverted umbrella sign. Okay. Next, there is maximum risk of dyselectrolytemia in enterocutaneous fistula. Which one? Guys, tell me, it is gastric, duodenal, jejunal, ileal. Which one? Gastric, duodenal, jejunal, ileal. Yes, it is high output fistula. Yes, obviously. So, Shravanti, Vishnupriya, Dr. Dikshit, proximal fistula. So, in small intestine, proximal fistulas are most dangerous because these are high output fistulas. So, proximal fistula means duodenal followed by jejunal followed by ileal. So, maximum risk of dyselectrolytemia, it is in duodenal enterocutaneous fistula. It is duodenal, and let me tell you, in exam they will give stomach also. Stomach is not the part of small intestine. So, question is related to enterocutaneous fistula. Okay. Next, what is the investigation of choice for diagnosis of small bowel carcinoid? Guys, this is the question expected in exam. Multiple times this question was asked. Tell me, it is 24 hours estimation of 24 hours urinary estimation of 5 HIAA. So, this is 24 hours urinary estimation of 5 hydroxyindole acetic acid, clear. Next question, tell me, what is the investigation of choice for diagnosis of Hirschsprung's disease? Hirschsprung's disease, guys, tell me. Very good. First person Shravanti, second is Muskan, third is Vishnupriya. Guys, it is rectal biopsy, so we go for biopsy. Next question, sawtooth appearance. This kind of appearance is there, guys. It is sawtooth appearance on barium enema. Seen in which condition? Sawtooth appearance. Very good. Dr. Parik, Risha Gautam, NASA Edge, Kamlesh, Muskan, Shravanti. It is diverticulosis. So, it is seen in colonic diverticulosis. That is sawtooth appearance. So, it is seen in colonic diverticulosis. Clear, guys? So, it is seen in colonic diverticulosis. So, that is colonic diverticulosis. Next, treatment of choice for FAP, familial adenomatous polyposis, where there is 100% risk of malignancy in colon and rectum, remove the both. So, guys, tell me the name. Total proctocolectomy. Very good. Muskan, you are the first person to reply correctly, followed by Vishnupriya. The treatment of choice is total proctocolectomy plus IPAA. So, it is TPC, total proctocolectomy plus ileal pouch anal anastomosis. So, guys, it is total proctocolectomy plus ileal pouch anal anastomosis, clear, right? Next question, what is the most common extra-intestinal malignancy in HNPCC? Let me tell you, let me see who is going to reply correctly. Brunda, Parik, NH, Megha, Ahir, Shakir, Wahid, Anuj, anonymous. Guys, tell me. Yes, very good. Muskan, Ranjan Sahani, it is endometrial followed by gastric followed by ovarian. So, how to remember, guys? Mnemonic is ego. How to remember? It is ego. So, that is endometrial followed by gastric followed by ovarian. So, this is endometrial. It is endometrial followed by gastric, endometrial followed by gastric followed by ovarian. So, it is endometrial followed by gastric followed by ovarian, clear. So, that is the most common extra-intestinal malignancy in HNPCC, hereditary non-polyposis colon cancer, easy. Next question, chemotherapy regimen for colorectal cancer, tell me. Easiest question, guys. Let me see who is going to reply correctly. Yes, chemotherapy regimen for colorectal cancer. Chemotherapy regimen, yes, Arun, Jayakumar, very good. First person to reply correctly is again Shravanti, very good. It is Folfox 4, guys, it is Folfox 4. Can you tell me the full form? It is Folfox 4. So, FOL, you know that this is folinic acid, also known as leucovorin. So, this is folinic acid, also known as leucovorin. F, that is 5-fluorouracil, and ox, what is ox? That is oxaliplatin. So, this is oxaliplatin. Clear? So, it is folinic acid, 5-FU, and oxaliplatin. Next question, what is the most common site of ischemic colitis? Ischemic colitis, yes, tell me guys, ischemic colitis, Shiva Muthalippan. Very good, you are correct. Tell me, Abhirut Bhayana, you are the first person to reply correctly. Guys, it is most common site of ischemic colitis. This is splenic flexure of colon. This is splenic flexure of colon. Clear? So, it is splenic flexure of colon, and you know that here there is thumb printing. So, what is the sign seen? Thumb printing. Next question, easy question. Accordion sign on CET is seen in. Guys, tell me, accordion sign on CET. Yes, first person to reply correctly, Shubhadeep. Second is Muskan. So, it is seen in pseudomembranous colitis. Guys, this is pseudomembranous colitis. So, accordion sign on CET is seen in pseudomembranous colitis. Next, can you tell me what is the most common early complication of ileostomy? Early complication, so it is ischemia or necrosis. Very good. It is ischemia or necrosis. That is the most common early complication. After that, easiest question. Everybody is correct. Vishnu, very good. Shipra, Sanjana, Anonymous, all of you are correct. Next, what is the most common site of fistula, perforation, and carcinoma in Crohn's disease? Fistula, perforation, and carcinoma in Crohn's disease. Easy question. And the cancer is same. Abhirut Bhayana, Kaur, very good. It is ileum. So, guys, it is ileum. So, this is ileum. Next question, what is the most common complication in ulcerative colitis after total proctocolectomy plus ileal pouch anal anastomosis? You know that in FAP also as well as in ulcerative colitis, we go for total proctocolectomy plus ileal pouch anal anastomosis. So, can you tell me guys what is the most common complication? Almost everybody is correct. First person to reply correctly is Hyde PP2, Hyde PP2, Ranjana Sahani. Guys, it is inflammation of pouch and known as pouchitis. So, this is inflammation of pouch known as pouchitis. Next, appendicular lump is managed by, tell me the name of that regime. What is the name of that regime? Yes, appendicular lump is managed by, name of regime. So, the name of regime guys, the name of regime, Oshner's-Sherin regime. Almost everybody is correct. So, this is Oshner's. This is Oshner-Sherin regime, you know, this is Oshner-Sherin regime, Oshner-Sherin regime. So, appendicular lump is managed by Oshner-Sherin regime. Clear? Next question, muscle cutting incision in appendectomy. There is only one incision which is muscle cutting. Let me see who is going to reply correctly. Only one incision which is muscle cutting, guys, only one. Tell me. Ratnadeep Samanta, first person Muskan, second is Abhirut, third is Batman. Batman is here, very good. And fourth is Sivaman Muthilippan. Okay. So, it's Rutherford Morrison, it is not Morgan, it is Rutherford Morrison. So, muscle cutting incision, that is Rutherford Morrison. Guys, it is Rutherford Morrison incision. Clear? So, this is Rutherford Morrison incision. Clear? After that, can you tell me what is the most common complication of hemorrhoidectomy? Guys, tell me. Hemorrhoidectomy. Very good. Pukhraj Dudi Bishnoi. Pukhraj, you are correct. Muskan, you are correct. Batman, you are correct. It is pain, and because of pain, there is urinary retention. So, the most common complication, guys, it is pain, and because of pain, the patient is having urinary retention. So, pain. Because of pain, there is urinary retention. Guys, I am telling you, there is another question which is expected in both NEET PG and FMGE. It is related to appendicular lump. They will give the clinical scenario and they will ask you which regime, Oshner-Sherin regime. Next, what is the preferred rectopexy in elderly and frail patients? Let me predict the question. They will ask you the types of rectopexy, which one is abdominal, which one is perineal. So, guys, here for elderly and frail patient, which tell me, which rectopexy is preferred? First person is Avinash Jangir, second is Batman. Guys, it is perineal. So, we go for perineal. It is perineal. And how to remember? You know that abdominal is War, Wells and Ripstein, that is abdominal. Perineal is pad. Pad means Altmeus and Delorme's. Altmeus and Delorme, these are perineal. Clear? Next question. What is the most common type of fistula in ano? There is a classification system known as Parkes classification 1, 2, 3, 4. So, tell me, intersphincteric, transsphincteric, suprasphincteric, extrasphincteric? 1, 2, 3, 4 guys, tell me which one. Intersphincteric, transsphincteric, suprasphincteric, extrasphincteric, which one? It is intersphincteric. We discussed that if classification starts from 1, 2, 3, 4, 5, what is the most common type? Type 1. So it is intersphincteric, followed by transsphincteric, followed by suprasphincteric, followed by extrasphincteric, followed by extrasphincteric. So intersphincteric, followed by suprasphincteric, followed by inter, followed by trans, followed by suprasphincteric, followed by extrasphincteric. How to remember? It's extra. So it's extra. Clear? Inter followed by trans, followed by supra, followed by extra. Okay. Next, what is the most common site of fissure in NO? Guys, see, this is a clock. So which o'clock position? This is a clock. At which o'clock position? Fissure in NO. Yes. Pukhraj, Dudi, Bishnoi, again correct. Gamiotrix, Gauri, Chella, Durai, all of you are correct guys. It is 6 o'clock position. So that is posteriorly in the midline. This is 6 o'clock position. So that is 6 o'clock. This is 6 o'clock position. So this is posteriorly in the midline. It is 6 o'clock position. Next easy question. Tell me, what is the treatment for resectable tumor in the rectum located 6 cm from anal verge? Resectable tumor 6 cm from anal verge. Tell me, first person to reply Ranjan Sahani, second is Rupa, third is NASA Edge. हम लोग क्या करेंगे? We go for LAR. What is the full form of LAR guys? It is low anterior resection. So what we go for here? हम लोग यहाँ करेंगे LAR. LAR, that is low anterior resection. So we go for low anterior resection, that is LAR. Clear? So next question guys, see, treatment of choice for carcinoma anal canal. All of you know the name of regime. Can you tell me the name of regime? Treatment of choice. Yes. Treatment of choice. Ravanti Kodali, tell me treatment of choice. Guys, it is not chemotherapy. No. Dr. Parikh, for carcinoma anal canal, you know the answer. Guys, let me see who is going to reply correctly. First person is Nikita Padhan. Nikita, very good. Very good. It is chemo radiation. Second is Dr. Azam. It is chemo radiation. So treatment of choice is Nigro regimen. Guys, it is Nigro regimen, which is chemo radiation. It is Nigro regimen. So Nigro regimen, that is chemo radiation. We give chemotherapy followed by radiation. Can you tell me which chemotherapy? So 5-FU with mitomycin C followed by radiation. So it is chemo radiation, we give chemo radiation. Clear guys? Next question, what is the best time for platelet transfusion in patients of splenectomy? Tell me, after ligation of splenic artery or after ligation of splenic vein? Best time for platelet transfusion in patients of splenectomy? Yes. Very good, Shravanti, NHB04, it is after ligation of splenic artery, because you know that in patients of ITP, yes, immune thrombocytopenia or immune thrombocytopenic purpura, there are formation of antibodies, and these antibody coated platelets are selectively destroyed in the spleen. So whenever splenic artery is ligated, you can easily transfuse the platelets. So it is after ligation of splenic artery. So this is after ligation of splenic artery, easy. So it is after ligation of splenic artery, easy. Next question guys, tell me what is the most common complication of splenectomy? Easiest question, most common complication of splenectomy. Yes, it's not infection, it's not OPSI. First person to reply correctly is Chetna. Chetna, you are absolutely correct. Followed by Shravanti Kodali, followed by Rupa. So guys, it is atelectasis. Atelectasis means collapse of ipsilateral lung. So what happens here? There is atelectasis. It is atelectasis. Clear? So that's the most common complication of splenectomy. Now see the next question. What is the most common type of hernia in females? So guys, you know that indirect inguinal hernia is the most common type of hernia in both males and females. So it is IIH. Most common type of hernia in both males and females. It is indirect inguinal hernia. But you know that femoral hernia is more common in females. But the most common type is indirect inguinal. Guys, majority of you are correct, but some of you are marking femoral also. No. Femoral is more common in females, but the most common type of hernia in females it is indirect inguinal hernia. Next, what is the gold standard treatment for inguinal hernia? And you know which repair we are doing? We are going for Lichtenstein repair. We are going for Lichtenstein repair. Lichtenstein repair. Okay, and let me predict the question. In this from hernia chapter, which question we are expecting in exam? Either they are asking triangle of doom or they are asking triangle of pain. They are going to ask the boundaries of triangle of doom, boundaries of triangle of pain, content of triangle of doom, content of triangle of pain, and the most commonly injured nerve in triangle of pain, means in laparoscopic hernia repair. So these are the expected questions. Now tell me guys, what is the content? What is the content of triangle of doom? Yes, very good, very good. So these are iliac vessels. So external iliac artery, vein. So iliac vessels. Content is iliac vessels, both artery and vein. Next question. What is the name of hernia through gap in lacunar ligament? Name of hernia through gap in lacunar ligament. Let me guys. It also starts with L. L. NASA edge, you are correct. First person to reply correctly is Ranjan Sahni. Very good, Ranjan. Second is Megha Ahir. Very good. Very good. And third is Dr. Anonymous. It is Logier's hernia. So guys, hernia through gap in lacunar ligament, lacunar, it is Logier's. So this is Logier's hernia. So this is Logier's hernia. Lacunar, Logier's hernia. Okay. Easy question. Next question. Hernia in which the posterior wall of sac is formed by viscera. Easiest question. Tell me. Let me see who is good. Who is going to mark the answer correctly. First person is Shravanti Kodali. And second person, guys, Shravanti Kodali. Very good, Shravanti, you are correct. Only one person till now. Shravanti. No, guys, only Shravanti is correct. Second is Nazar. Nazar is very good, Nazar. Third is NASA H. Fourth is Rupa. Guys, it is sliding hernia. When hernia in which posterior wall of sac is formed by viscera, it is known as sliding hernia. This is sliding hernia. So this is sliding hernia. Next question, you can see here. Omphalocele abdominal content is covered inside by. Let me predict the question. From hernia, we are expecting a question related to omphalocele or gastroschisis in both NEET PG and FMGE. So go through this topic, omphalocele and gastroschisis. So in omphalocele, abdominal content is covered inside by, guys, outside there is amnion, inside by peritoneum. So outside there is amnion. Amnion is outside, amnion, that is outside, and inside there is peritoneum. And how to remember, guys? Mnemonic is pin, peritoneum is in. So inside it is peritoneum and the mnemonic is pin. Pin, peritoneum is in. Clear? Next, treatment of choice for recurrent desmoid tumor. First tell me, what is the treatment of desmoid tumor? Yes, it behaves like sarcoma. Desmoid tumor. So treatment is surgical excision, but what happens? There is high risk of recurrence. So if there is recurrent desmoid tumor, in that case we give surgery plus radiotherapy, and Ranjan Sahni, you are correct this time also. So guys, we go for surgery plus radiotherapy. So for recurrent desmoid, it is surgery plus radiotherapy. Clear, guys? So this is surgery plus radiotherapy. Okay. Next question. Tell me hardest renal stone. Which stone is hardest? Let me see who is going to mark this question correctly. First person to reply correctly. First person is Shravanti, second is very good. So guys, it is cystine. Cystine is the hardest stone. Somebody is asking that, sir, please tell the important TNM staging. Guys, most important is breast. I am repeating, most important is breast. After that, carcinoma gallbladder. Carcinoma gallbladder. After that, CA stomach, carcinoma stomach, then colorectal cancer, colorectal cancer, colorectal, and oral cavity, means head and neck, especially oral cavity, right. So first, if you want to prioritize, first most important is breast, second is gallbladder, third is colorectal, fourth is oral cavity, and fifth is carcinoma stomach. These are the 5 most important staging. If you have seen INI-CET paper on 17th, they asked one question related to colorectal cancer. Okay. Next, if there is a stone in ureter, lower ureteric stone, obviously it is best treated by ureteroscopy. So that is URS. That is URS, not ESWL, guys, it is URS, ureteroscopy. So lower ureteric stone is best treated by URS. Next, putty kidney, cement kidney. Guys, let me tell you, this question is, again, we are going to predict that there will be one question related to tuberculosis of genitourinary tract, जिसमें इमेज दिया रहेगा पुट्टी किडनी का या सीमेंट किडनी का. So or there will be a clinical description of sterile pyuria. This question was there in INI-CET on 17th. So genitourinary tuberculosis very important. We are expecting a question in NEET PG as well as FMG. बताइए जरा पुट्टी किडनी and cement kidney, all of you are correct. It is seen in tuberculosis. Next, pulsatile secondaries. This question was asked Again on 17th in INI-CET, pulsatile secondaries means it is osteolytic and hypervascular. It is seen in 2 malignancies. Guys, tell me. First person Rupa, second person Batman. Very good, Batman, you are correct. कौन सा thyroid malignancy? Guys, can you tell me? It is RCC. And which thyroid malignancy? RCC and follicular carcinoma thyroid. So pulsatile secondaries are seen in RCC and follicular carcinoma thyroid. Right, this was asked in INI-CET on 17th. Next question, most common cause of death in ADPKD? Autosomal dominant polycystic kidney disease. What is the most common cause of death? Most common cause of death, guys, tell me. Shravanti Kodali, very good. Shravanti, yes. Avinash, you are also correct, but not completely. It is because of cardiovascular disorders. So Dr. Parikh, you are correct. It is because of cardiovascular disorder. There is uncontrolled hypertension, so it is related to cardiovascular disorder. Next question, easy question. What is the gold standard treatment for PUJ obstruction? Gold standard, guys, tell me. Gold standard, all of you know. Gold standard, what is the gold standard treatment for PUJ obstruction? It's a big name. Anderson, Hines, dismembered pyeloplasty. It is not cystoscopy, it is pyeloplasty. What is the name, guys? It is Anderson. So the name is Anderson Hines dismembered pyeloplasty. So this is Anderson Hines dismembered pyeloplasty. Clear? So it is Anderson Hines dismembered pyeloplasty. Easy. So Anderson Hines dismembered pyeloplasty. Next is adder head. Every year this question is asked. Adder head or cobra head appearance on IVP is seen in. Yes, very good. Uncomplicated uretrocele. Very good. It is seen in uretrocele. You are correct. Anonymous, it is seen in uretrocele. So adder head or cobra head appearance on IVP, it is seen in uretrocele. Okay. Next question, most common primary bladder stone. Let me see who is genius over here and going to reply this question correctly. Most common primary bladder stone. Yes, very good. First person Shravanti Kodali, very good Shravanti. Most of the times you are correct. Shravanti, very good. Till now only one person. So guys, it is ammonium urate. It is ammonium urate, and there was another question in NEET PG about this ammonium urate. Patients who are having chronic laxative abuse, they are prone to chronic dehydration. So any patient who is having chronic dehydration, this stone is formed, ammonium urate. Next, what is the most common cause of bladder calcification worldwide? Bladder calcification worldwide, guys, tell me, what is the most common cause of bladder calcification worldwide? That is schistosomiasis. This is schistosomiasis. So the most common cause is schistosomiasis. Next, investigation of choice for diagnosis of bladder rupture. Let me tell you, again in NEET PG as well as FMGE, we are expecting one question related to either urethral injury or bladder rupture. Definitely there will be one question. I am repeating, either you are getting a question related from bladder rupture or urethral injury. How to differentiate bladder rupture? Bladder will be collapsed. In urethral injury, usually bladder is distended. So distended bladder rules out bladder rupture. So guys, tell me, what is the investigation? Very good, everybody is correct, guys. It is CT cystography. So that is CT cystography. It is CT cystography. Next easy question, can you tell me what is the most common site of carcinoma gallbladder? You can see this and tell me. What is the most common site of carcinoma gallbladder, guys? It is here. Tell me the site. Shravanti, very good. Trigone. Which wall of trigone, guys? See and tell me which wall of trigone. It is obviously posterolateral wall of trigone. So most common site of carcinoma bladder, that is posterolateral wall of trigone. Clear? So this is posterolateral wall. So this is posterolateral wall of trigone. Right. So that is posterolateral wall of trigone. It is posterolateral wall of trigone. Next question, you can see chemotherapy regimen for metastatic carcinoma bladder. Let me see who is the genius over here. This question was asked in NEET PG. NEET PG. Megha, tell me. Shravanti, Jawad, Mateen, Shubhadeep Singh. No. Chemotherapy regimen. Guys, it is not BCG. First person to reply correctly, Shravanti, very good. Avinash, very good. Batman, it is not Folfox. Folfox is for colorectal cancer. It is, guys, MVAC. Remember, it is MVAC. It is MVAC. So what is MVAC? It is methotrexate, vinblastine, adriamycin, cisplatin. So it is methotrexate. So guys, it is methotrexate, विनब्लास्टिन. हाउ टू रिमेंबर? इन एग्जाम वी मीन्स विनक्रिस्टिन. यू थिंक वी का मतलब विनक्रिस्टिन. एग्जाम में कैसे याद करना है? ब्लैडर ब्लास्टिन. रिमेंबर ब्लैडर ब्लास्टिन. सो इट इज ब्लैडर ब्लास्टिन. A adriamycin and C cisplatin. So it is adriamycin and C cisplatin. So it is cisplatin. Clear? So it is methotrexate, vinblastine, adriamycin, cisplatin. Okay. Next, what is the most important landmark in TURP, guys? First person to reply correctly, Shabdeep Singh. Chetna Vishwas is second, Nikita Padhan is third, and fourth is Rahul Waghela. Very good. It is verumontanum. Why? Because verumontanum is located just proximal to external urinary sphincter. So this is most important distal landmark. So most important landmark, it is verumontanum. Guys, this is verumontanum. Why? Because verumontanum is located just proximal to external urinary sphincter. Next, what is the most common complication of TURP? Avinash, it is not hemodilution. Most common complication of TURP. No, it is not dilutional hyponatremia. Batman, it is not that. Yes, Sai Reddy, you are correct. It is retrograde ejaculation. So most common complication is retrograde ejaculation. This is retrograde ejaculation in 75%. After that, impotence in 10%. After that, incontinence. So it is retrograde ejaculation. This is the most common complication in 75%. Next, what is the most common site of carcinoma prostate? See a prostate. Most common site, and all of you know which zone, which lobe. Guys, tell me which zone, which lobe. Very good. So, Pavan Putra Hanuman. Very good, Pavan Putra, you are correct. Pavan Putra Hanuman. Very good. Pavan Putra Hanuman, you are absolutely correct. So, it is posterior lobe or peripheral zone. So, what? It is posterior lobe or peripheral zone. Clear? So, it is posterior lobe or peripheral zone. Clear? So, this is posterior lobe or peripheral zone, right? That is the most common site. Next question, guys. What is the most common congenital malformation of urethra? Easy question. It is very, very common. 1 in 250. Most common congenital malformation of urethra. Yes. Shravanti Kodali, very good. Shabdeep Singh, very good. Shabdeep. Very good. So, guys, it is hypospadias. That is the most common congenital malformation of urethra. It is very common, 1 in 250. So, that is hypospadias. So, that is hypospadias. After that, keyhole sign on prenatal ultrasound, it is seen in. Very good. Sakir, you are marking the answer in advance. Rajni, you are also marking the answer in advance. Nikita, guys, all of you are correct. It is posterior urethral valve. Posterior urethral valve. After that, can you tell me what is the most common site of urethral injury? It is anterior urethra or posterior urethra, and which part of urethra? Which part of urethra? NASA edge. First person to reply correctly, membranous. Now you have to tell me which urethra in membranous, which junction? It is bulbomembranous or prostatomembranous? Guys, tell me. It is bulbomembranous or prostatomembranous? So it is bulbomembranous. So most common site, it is membranous urethra. So guys, it is membranous, and in membranous it is BM followed by PM. So it is bulbomembranous followed by prostatomembranous. So it is membranous urethra, that is BM followed by PM. It is BM followed by PM. So that is bulbomembranous followed by prostatomembranous. After that, tell me, circumcision is sufficient for, it is sufficient for carcinoma penis located at. Circumcision sufficient for carcinoma penis located at. Easiest question. First person to reply correctly is Bhupesh Yadav. Very good, Bhupesh. Second is Rupa, third is Shravanti. So it is at prepuce. If malignancy is located at prepuce, obviously we go for circumcision. So circumcision is done. Clear? Next question. Investigation of choice for non-palpable undescended testis. So non-palpable undescended testis, what is the investigation? If it is non-palpable, obviously it is in abdomen, and we have to search in abdomen. So tell me which investigation should be done. Yes, first person to reply correctly is Pavan Putra Hanuman. Is बार भी Pavan Putra Hanuman. Very good, Pavan Putra. So what? Investigation of choice for non-palpable undescended testis. This is diagnostic laparoscopy. So guys, this is diagnostic laparoscopy. Clear? So this is diagnostic laparoscopy. Diagnostic laparoscopy. After that, surgical exploration in testicular torsion. Surgical exploration in testicular torsion should be done within. Previously it is said 4 hours, let me tell you, now it is 6 hours. So guys, previously it was said that 4 hours, now the latest guidelines says within 6 hours. So latest guideline says within 6 hours. As soon as possible, Batman, it is 6 hours, within 6 hours. Next, varicocele. What is the location of pampiniform plexus of veins in relation to testis? So you know that in varicocele, what is the location, guys? Tell me. Yes, Irfan Khan, Raj, Ratandeep, Kaur, Bhupesh. Tell me. Posterior and above, Pavan Putra Hanuman, very good. इस बार भी सबसे पहले. So what, guys? It is posterior and above testis. So it is posterior and above. So that is posterior and above testis. Posterior and above testis. So next question, guys, tell me what is the most common bilateral testicular tumor? Most common bilateral testicular tumor. Yes, no, it's not seminoma. Seminoma is most common primary bilateral testicular tumor. First person again Pavan Putra Hanuman. Very good. इस बार भी सही है. So it is lymphoma, guys. It is lymphoma, and all of you know which lymphoma is there in testis. Most common type, non-Hodgkin's, and which variety of non-Hodgkin's lymphoma, guys? It is DLBL. What is DLBL? It is diffuse large B-cell lymphoma. So what's the name? It is diffuse large B-cell lymphoma. Clear? Next question, easy. What is the most common symptom of peripheral arterial occlusion? All of you know that it is characterized by 5 P's: pain, pallor, paresthesia, paralysis, pulselessness. So what is the most common symptom? All of you know it is pain. That's pain. Next question, Lehret's syndrome. This is important. Lehret's syndrome is erectile dysfunction. Can you tell me where is the obstruction? Let me see who's the genius over here. Lehret's syndrome, where is the obstruction, guys? Let me see who's the genius over here. Iliofemoral, Shubhadeep. It is not exactly iliofemoral. Yes. Very good, very good. It is aortoiliac bifurcation. So Lehret's syndrome, erectile dysfunction seen due to obstruction of aortoiliac bifurcation. So guys, it is because of aortoiliac bifurcation. So it is because of aortoiliac bifurcation obstruction. Easy. Next question, very easy. What is the most commonly involved vessel in Burgess disease? Let me give you the hint. There is involvement of medium sized and small sized vessels. Now you tell me. Medium sized and small sized vessels, and guys, how to remember? Mnemonic is TPR. Mnemonic is TPR. So what is TPR? It is tibial followed by plantar followed by radial. So it is tibial. This is tibial followed by plantar followed by radial. Tibial followed by plantar followed by radial. Tibial, plantar, radial. Next, can you tell me what is the most common cause of acquired AV fistula? And let me tell you, it is not hemodialysis. Acquired AV fistula. Guys, acquired AV fistula, Shravan Rinku, you are correct, and Pavan Putra Hanuman, very good, you are also correct. Penetrating trauma. It is because of penetrating trauma. Clear, guys? So it is because of penetrating trauma. Penetrating trauma. Easy. Next is cutoff diameter for surgery in abdominal aortic aneurysm. We are expecting this question. कई बार आ चुका है. What is the cutoff diameter? Guys, you know it is more than equal to 5.5 centimeter. For abdominal aortic aneurysm, it is more than equal to 5.5 centimeter. और अगला question आप लोग बताइए. What is the most common site of subclavian artery stenosis? Most common site. Guys, tell me. The most common site of subclavian artery stenosis. Very good. Everybody is correct. Most common site. It is first part. कौन सा? Right या left? It is left. So it's first part of left subclavian artery. So guys, it is first part of left subclavian artery. Left subclavian artery. And next question, easy question. इस question को हम लोग expect करें exam में. What is the best graft for CABG, coronary artery bypass grafting के लिए? What is the best graft, guys? Tell me. You know, it is arterial graft which is preferred, and the first person to reply correctly, it is Shravanthi Kodali and Pavan Putra Hanuman. Very good. It is Lima. Left internal mammary artery, that is best graft. And what is most commonly used? Most commonly used is reverse long saphenous vein. Clear? Next question, guys. What is the most common site of DVT? Easiest question. Most common site of DVT. Which vein? All of you know. Most common site of DVT. Yes. Very good. It is calf vein or soleal vein. Pavan Putra Hanuman, you are correct again. You are correct again. Rupa, Shravanti, it is calf or soleal vein. So guys, it is calf. calf or soleal vein. Clear? So, that is calf or soleal vein. So, it is calf or soleal vein. Next, what is the gold standard treatment for varicose vein? Guys, tell me, this was the latest question in one of the latest exam. Gold standard treatment for varicose vein. So, tell me gold standard treatment of varicose vein. Yes, it is endothermal ablation, and Suneha Thippeswamy is the first person to reply. Suneha Thippeswamy, you are correct guys. Yes, it is endothermal ablation, and in this endothermal ablation what we do? We perform radio frequency ablation or we go for endovenous laser ablation. Clear? So, it is radio frequency ablation or endovenous laser ablation. Next question, familial version of congenital lymphedema is known as, let me see who is going to reply correctly. Familial version of congenital lymphedema is known as, guys tell me, easiest question. First person Kanupriya Saini, and again second Pawan Putra Hanuman, very good. Third Shravanti, very good. So, guys it is Milroy's disease. What is the name? This is Milroy's. So, this is Milroy's disease. Milroy's disease. Easy. Next question, what is the most common posterior mediastinal mass? All of you know. Yes, posterior mediastinal mass. Shravan Rinku, first person to reply. Second is Shabdeep Singh, third is Parik. This is guys neurogenic tumor. So, posterior mediastinal mass, that is neurogenic tumor. So, this is neurogenic tumor, okay. Next question you can see. Next, presence of fat globules in sputum and urine after road traffic accident leading to long bone fracture. Easiest question. Tell me. Fat embolism, very good. Pawan Putra Hanuman, again you are correct. This is suggestive of fat embolism. So, characteristic feature, इस question को भी expect कर रहे हैं हम लोग. We are expecting this question in exam. Fat embolism. Okay. Next, X-ray PA view showing flat surface of coin. Where is the location of coin? Chest X-ray PA view showing the flat surface of coin. PA view showing the flat surface. It is in, guys, in first person to reply correctly. Yes, it is Shiri Suresh. Shiri Suresh, first person, it is esophagus. It is in the esophagus. So, whenever you go for X-ray on PA view, you can see the flat surface. On lateral view, you can see the edge in esophagus. Can you tell me guys, what is the most common symptom of carcinoma lung? Carcinoma lung, most common symptom. Easiest question. First person, NHBO4. NHBO4, you are correct. Second person is Siri Suresh. Third is Rupa. It is cough. Cough. So, most common symptom is cough in carcinoma lung. Next question, degree of burn with involvement of subcutaneous fat. Degree of burn with involvement of subcutaneous fat. Guys, tell me. Yes, degree of burn with involvement of subcutaneous fat. First is NHBO4, third is Manisha Agrawal, third is Rope. Guys, it is third degree. So, this is also known as full thickness burn. This is third degree, also known as full thickness burn. Full thickness burn. And let me tell you, we are expecting one question related to either degree of burn or stage of pressure ulcer or pressure sore. How to identify? See, both are same. So, if you see first degree or stage 1, there is involvement of epidermis. You see second degree or stage 2, there is involvement of epidermis plus dermis. If you see third degree, here there is involvement of epidermis plus dermis plus subcutaneous tissue. Clear? And what about fourth degree? In fourth degree, there is involvement of skin plus underlying structure like muscle and bone. So, in stage 4, the muscle or bone will be exposed. So, this is same for burns and it is same for pressure ulcer. I am repeating. In first degree burn, there is involvement of epidermis. In stage 1 pressure ulcer, what happens? There is erythema. In second degree burn, there is involvement of epidermis plus dermis, and in stage 2 pressure ulcer, there is epidermis and dermis loss. In third degree, there is involvement of epidermis plus dermis plus subcutaneous tissue, and in stage 3 pressure ulcer, there is loss of epidermis plus dermis plus subcutaneous tissue. And fourth degree burn, apart from skin, there is involvement of underlying structures like muscle or bone, and in stage 4 pressure ulcer, apart from skin involvement, muscle or bone is exposed. Guys, I am repeating this question again. We are expecting one question related to the burn classification and pressure ulcer staging. Okay. Next, you know that minimum urine output after adequate tissue perfusion 1 ml per minute in adults and 0.5 to 1 ml per minute in children. Next, Which skin malignancy is characterized by A, B, C, D, E? Everybody marked it correctly. Shiv Gajera, very good. Shiv Gajera, very good. It is malignant melanoma. So, this is malignant melanoma. And guys, another question, can you tell me what is the most common site of keloid? Keloid is more common in darkly pigmented races. Here, there is excessive scar tissue which is going to grow beyond, it extends beyond the wound incision or margin. So, guys, it is sternum, you know, in the chest, most common site is sternum. So, all of you know, the most common site is sternum. Next question, stage of, now you have to tell me guys, stage of pressure ulcer, I already discussed with full thickness skin loss extending into subcutaneous tissue. Full thickness skin loss extending into subcutaneous tissue. Which stage 1, stage 2, stage 3, stage 4? Subcutaneous tissue, everybody is correct. And the first person is Pawan Putra Hanuman, second is NHBO4, third is Idli Sambar. Welcome Idli Sambar, ek plate idhar bhi bhejiye. Clear? So, what? It is guys stage 3. Stage 3. Stage 3. Clear? So, Idli Sambar, you are from which state? Yes. Now, guys, this question was asked, this question in INI-CET on 17th of this month, negative pressure wound therapy. It is used in vacuum assisted closure. Negative pressure, how much negative pressure is used guys? It is minus 125 mmHg. Okay? And it's very, very important. I hope you will remember. Next question, STH, subdural hematoma, is caused by injury of which vein? Guys, tell me. Subdural hematoma. Yes, subdural hematoma is caused by injury of cortical veins or bridging veins. So, it is caused by injury of cortical veins or bridging veins. So, cortical veins or bridging veins. So, it is because of injury of cortical veins or bridging veins. Cortical veins or bridging veins. Worst headache of life. Tell me which hemorrhage? Worst headache of life. Shubhadeep Singh, you are correct. Subarachnoid hemorrhage. Patient is going to describe this hemorrhage, this headache as worst headache of life. Next, investigation of choice for diagnosis of diffuse axonal injuries. In these patients, patient is in the vegetative state. NC-CT is normal. Guys, tell me. Investigation of choice, first person is NHBO4, it is MRI. So, all of you are correct, MRI. Next, what is the most common astrocytoma in children? In children guys, what is the most common type of astrocytoma? Sonali, Irfan, Raj, first person NHBO4, it is pilocytic astrocytoma, also known as type 1. So, grade 1 guys, this is pilocytic. And in adults, you know, it is glioblastoma multiforme. In children, it is pilocytic. Next question, dural tail sign and sunray spicules are seen in. Dural tail sign and sunray spicules, these are seen in, yes. NHBO4, yes, you are on fire. Most of the times you are correct, NH, very good. Meningioma. It is meningioma. And next question guys, you already know what is the most common brain tumor. Most common brain tumor or most common malignancy of brain, that is metastasis. So, it is metastasis. And most common primary brain tumor, that is meningioma. Next, there is central necrosis with ring like enhancement on MRI, and it is also known as butterfly tumor. Tell me which one. I am waiting. Shalu, Avinash, Jangid. Yes, Pawan Putra Hanuman, you are absolutely correct this time also. Shravanti Kodali, guys, it is glioblastoma multiforme. So, it is GBM, glioblastoma multiforme. Here you are going to find central necrosis with ring-like enhancement on MRI. It is also known as butterfly tumor. Why? Because it crosses midline. Clear? Next question, most commonly used flap for reconstruction of head and neck defect. Easiest question. Ratandeep, you are correct. Tell me guys, most commonly used flap. Yes, first person to reply correctly, Pawan Putra Hanuman, second is Shravanti. Guys, again it is PMMC flap, pectoralis major myocutaneous flap. So, it is PMMC flap, that is pectoralis major myocutaneous flap. Okay. Next is Abe Eastlanders flap. It is for reconstruction of the lip. We are going to take it from upper lip. So, can you tell me it is based on which vessels? Abe Eastlanders flap, it is based on which vessel? So, guys, obviously labial artery. Which labial artery? Superior labial artery. Shravanti, you are correct. It is based on superior labial artery. So, this is based on superior labial artery. So, it is based on superior labial artery. Superior labial artery. So away is Slander's flap, it is based on superior labial artery. Okay. Most common salivary gland tumor, guys, tell me what is the most common salivary gland tumor? Most common salivary gland tumor, Shubhadeep Singh, it's correct. It is pleomorphic adenoma. All of you are correct. So it is pleomorphic adenoma. Pleomorphic adenoma. Pleomorphic adenoma. Next, what is the most common site of salivary gland stone? In which gland you are going to find salivary gland stone? Guys, tell me, salivary gland stone, most common in which gland? You know the answer. Yes, Dr. Rajni, you are correct. Dr. Shravanti, you are correct. So guys, it is submandibular gland. Most commonly it is seen in submandibular gland. That's submandibular gland. Clear? Next question. Ranula is related to which salivary gland? You know ranula, it is below tongue in the floor of mouth in relation to which gland? Manjarul Islam, very good. Pawan Putra Hanuman, again you are correct this time. It is sublingual gland. So which gland, guys? It is sublingual. So name of the gland, this is sublingual gland. Clear? Next, Liar sign on angiography is seen in which tumor? Here is the tumor, guys. So tell me, Liar sign on angiography, it is seen in which tumor? Liar sign on angiography is seen in, yes, guys, you are correct. It is seen in chemodectoma, also known as carotid body tumor. Catherine Jennifer, very good. Catherine Jennifer, you are correct. Ratandin Samantha, you are also correct. It is carotid body tumor. So this is carotid body tumor. And what is the other name of carotid body tumor, guys? All of you know, this is also known as chemodectoma. Okay. Next, what is the most common site of cystic hygroma? Cystic hygroma, what is the location, guys? Tell me. Most common site of cystic hygroma, all of you know. Yes, it is posterior triangle of neck. Avinash Jangid, NH, Shravan, Rinku, Pavan Putra Hanuman, all of you are correct. So this is posterior triangle of neck. So that's the posterior triangle of neck. Clear? So it is posterior triangle of neck. Next question. What is the most commonly injured nerve in sentinel lymph node biopsy of breast cancer? Very important. We are expecting this question. Most commonly injured nerve in sentinel lymph node biopsy of breast cancer. Guys, yes, it is intercostobrachial nerve. So what's the name? This is intercosto. So that is intercostobrachial nerve. So this is intercostobrachial nerve. Easy. Intercostobrachial nerve. Next question. What is the most common type of soft tissue sarcoma? Easiest question, and you know the answer. It is liposarcoma followed by leiomyosarcoma. So answer is liposarcoma. So that is liposarcoma followed by leiomyosarcoma. It is leiomyosarcoma. Next, easy question. Let me see who is going to reply this question correctly. First line agent in DFSP. Let me give you the clue. The same agent which is given in GIST, the same agent which is given in CML, the same agent is given here also. In GIST, CML, same agent is given. Ayush Negi, first person to reply. Second is Pavan Putra Hanuman. It is imatinib. So guys, it is imatinib mesylate, that is imatinib. Next, type of graft in identical twins. Suppose you are taking a graft from identical twins. What is the name? What is the name? What is the name? If the graft is taken from identical twins, Rupa, it is not allograft. What is allograft? अगर आप लोगों को पंजाबी आती है तो ज़रा देखिए, मदर है वो मदर अपने बच्चे को ग्राफ्ट देती है और क्या बोलती है? एलोग्राफ्ट बोलती है. एलोग्राफ्ट बिकम्स एलोग्राफ्ट. इसका मतलब एलोग्राफ्ट मीन्स सेम स्पीशीज. ऑटोग्राफ्ट मीन्स फ्रॉम द पेशेंट्स बॉडी. Isograft, identical twins. Xenograft, heterograft, different species. Okay guys, so this is identical twins. What's the name? This is isograft. So this is what? Isograft taken from identical twins. Clear? What is the most common indication of pediatric liver transplantation? Tell me. All of you know the answer. RK, yes, it's important for NEET also. Most common indication for pediatric liver transplantation, guys, tell me. Everybody is correct. Extrahepatic biliary atresia. So that is extrahepatic biliary atresia. Extrahepatic biliary atresia. Next, what is the best location of needle insertion in tension pneumothorax? Guys, I'm telling you, 100% chances are there that you are going to get at least one question of tension pneumothorax in both NEET PG and FMGE. I'm telling you, 100% chances are there. There will be description, and after that the examiner will ask you what's the management, whether you have to insert the needle or we have to insert the ICD. 100% chance a question आएगा. So what is the best location of needle insertion in tension pneumothorax in adults? Fifth intercostal space in anterior axillary. It is not mid axillary, in anterior axillary line. So, it is fifth intercostal space. So, that is fifth intercostal space in anterior axillary line. Clear? In anterior axillary line. Anterior axillary line. Remember this, anterior axillary line. Next, there is trauma transfusion protocol, and according to trauma transfusion protocol, guys, packed cells, plasma and platelets are given in the which ratio? Packed cell, plasma and platelets, very good, everybody is correct, is given in the ratio of 1:1:1. And next, what is the best predictor of outcome in GCS? Best predictor of outcome in GCS, guys, best predictor, tell me, EVM, eye opening, verbal response, motor response. It is best motor response. So, it is best motor response. It is best motor response. And there is another question we are expecting. Pakka ek question aayega GCS se. I am telling you, 100% chances are there that you are going to get a question related to GCS. They are going to ask what kind of head injury is there. Mild, moderate, severe. Mild mein, what is the score of GCS? In mild, the score is 13 to 15. In moderate, it is 9 to 12, and in severe, it is less than equal to 8. Less than equal to 8. Let me tell you how to remember. It's very easy to remember. See, MO, that is moderate, 9 to 12. MO याद कैसे करना है? MO मतलब मूवी. MO मीन्स मूवी. और आप किसी को मूवी के लिए पूछेंगे तो क्या पूछेंगे? चलती है क्या 9 से 12. नाउ यू रिमेंबर गाइस, चलती है क्या 9 से 12. सो चलती है क्या 9 से 12. सो मूवी 9 से 12, so moderate 9 से 12, so 9 to 12. Remember just one thing, moderate is 9 to 12, so mild obviously is 13 to 15 and severe is obviously less than equal to 8. याद रहेगा, चलती है क्या 9 से 12. Okay, clear guys? So next, minimum number of people required for log roll, ideal 5, minimum number of people required 4. Easy. Next question. Next, first investigation done in blunt trauma abdomen patient, all of you know, it is fast focused assessment with sonography for trauma. Next, how many letters are there in fast? Can you see? There are 4 letters. In fast, you can see there are 4 letters. So, within how many minutes fast is done? 2 to 4 minutes. 4 letters, 4 minutes, 4 P's. Remember, 4 letters, 4 minutes, 4 P's. What are those 4 P's? We are going to assess pericardial sac, perihepatic region, perisplenic region, pelvis. So, 4 letters, fast, 4 minutes, we are going to assess 4 P's. Okay. Next, what is the trauma triad of death? How to remember, guys? The mnemonic is hypertrophic cardiomyopathy. It is HCM, hypertrophic cardiomyopathy. So, it is hypothermia, you know, it is hypothermia. C, that is coagulopathy. So, C, this is coagulopathy, and M, metabolic acidosis. It is metabolic acidosis. Metabolic acidosis. So, hypothermia, coagulopathy, metabolic acidosis. Out of these, which one is the most common cause of death? The most common cause of death, that is coagulopathy. So, coagulopathy, that is the most common cause of death. Easy. So, that is the most common cause of death. Next question, guys. Investigation of choice for diagnosis of tension pneumothorax and flail chest. Let me see who is the genius over here. Who is the genius over here? Yes, very good. Shankar Bhatnagar, first person to reply. Sanskar Bhatnagar. Shravanthi, very good. Suneha Thippeswamy, guys, it is clinical. Don't send the patient for chest X-ray or CT. Patient will expire in radiology department. So, what? In tension pneumothorax and flail chest, how to make the diagnosis? It is clinical. And if you are suspecting tension pneumothorax, put a wide bore needle in second intercostal space, in mid clavicular line in children, and in fifth intercostal space in anterior axillary line in adults. Right? Next question. What is the needle? Name of the needle used for creating pneumoperitoneum, guys. We are expecting one image based question. Either it will be Veris needle or Humby knife or Babcock's tissue forceps or Ohm forceps or sometimes Devers retractor, artery forceps. These are the important instruments which are asked. Okay. So, guys, it is Veris needle. So, what is the name of the needle? All of you are correct. It is Veris needle. Next question. Most commonly performed bariatric surgery worldwide. Guys, tell me what is the correct answer? Waiting for your reply, guys. Most commonly performed bariatric surgery worldwide. Tell me. Easy question. It's not Roux-en-Y. Previously it was Roux-en-Y. Now it is sleeve gastrectomy. It is sleeve gastrectomy. Guys, it is sleeve. Remember this. It is sleeve gastrectomy. Remember this. It is sleeve gastrectomy. Okay. What is the suture used for subcuticular suturing? Subcuticular suturing. Okay. Shravanti, subcuticular suturing. This was the question in INI-CET. What's the name? No, it's not Vicryl. Very good. NHSO4, you are correct. It is monocryl. It is monocryl or polyglycaprone. Polyglycaprone. Monocryl or polyglycaprone. Clear? Next, what is the suture used for vascular anastomosis? Guys, tell me, vascular anastomosis which suture is used? It is not Vicryl. Vascular anastomosis, Pavan Putra Hanuman वापस आ गए हैं. Very good guys, it is proline. It is proline, that is also known as polypropylene. So, this is proline or polypropylene. Easy. So, proline or polypropylene. Next, what is the preferred vein? Guys, what is the next? What is the suture length to wound length ratio? It is known as Jenkins rule. So, this is Jenkins rule. Suture length to wound length ratio. It is Jenkins rule. And what should be the ratio, guys? Ratio, it is 4:1. Ratio should be 4:1. Most common hospital acquired infection. Megha wants to ask that, sir, कि Vicryl कहाँ use करते हैं? Very easy, guys. How to remember where to use Vicryl? Vicryl is used in the organs where there is stone forming tendency. Mnemonic है कब. How to remember? Mnemonic is कब. Now see here, Vicryl is used for C, CBD, U, ureter, B, bladder and bowel. So it is CBD, ureter, bladder and bowel. We are using Vicryl. Okay, Megha? Clear? Next, what is the most common hospital acquired infection, guys? It is UTI. It is urinary tract infection. Next, what is the best time to give prophylactic antibiotics? Tell me. I am waiting for your reply. NHBO4, फिर से आप वही पूछना चाहते हैं question? Okay, I am replying. In INI-CET, there was one question, guys. Patient is having tension pneumothorax, signs and symptoms of tension pneumothorax, and patient is having head injury also. GCS is less than equal to 8. If patient GCS is less than equal to 8, this is severe head injury. सबसे पहले हम क्या follow करेंगे? What we follow? A, B, C, D, E. A, B, C, D, E we have to follow. ठीक है? So, hypotension, tension pneumothorax किसमें आएगा? B में आएगा. Because here it is ventilation related issue. सबसे पहले airway. So if patient GCS is less than equal to 8, it's an indication for airway insertion. If there is obstructed airway, maxillofacial trauma, patient is having noisy breathing or GCS is less than equal to 8, सबसे पहले आप क्या करेंगे? Airway management. After that, in breathing, what happens? If patient is having intact airway and patient is having tension pneumothorax, then we insert the needle. I hope it's clear. NHBO4, I hope it's clear. Okay. So, first we go for endotracheal intubation if patient is having head injury, patient is having obstructed airway. Clear? Okay. Now, coming back. Okay. So, guys, best time to give prophylactic antibiotics is at the time of induction. It's at the time of induction of anesthesia or 1 hour before surgery. 1 hour before surgery. So, at the time of induction of anesthesia or 1 hour before surgery. Clear? 1 hour before surgery. Okay. Next question, guys. What is the preferred vein for TPN? All of you know, subclavian vein followed by internal jugular vein followed by femoral. So, subclavian followed by internal jugular followed by femoral. Okay. Next, can you tell me what is the most common complication of central venous catheterization? Easy question. Very good. Catheter related sepsis. So, most common complication is catheter related sepsis. Can you tell me most dangerous complication? Most common is catheter related sepsis. So, it is catheter related sepsis. Guys, can you tell me the most dangerous complication? What is the most dangerous complication? The most dangerous complication is pneumothorax. That is why whenever you insert central line, you send the patient for check X-ray. Next, how much is the amount of blood loss in class 2 hemorrhagic shock? We are going to get one question related to shock. Hypovolemic shock में कितना blood loss होता है? You know, guys, in class 1 0 to 15, in class 2 15 to 30, in class 3 30 to 40, and in class 4 more than 40. And how to remember, guys? It's very easy. Very easy. Remember 330 440. 330 440. So 3 is 30 means 30 to 40, 4 is more than 40, and 1 is 0 to 15 and 2 is 15 to 30. Okay. So correct answer is, how much is the blood loss here? 15 to 30%. Next, easy question, you know, if a patient is having hypovolemic shock, in that case, or hemorrhagic shock, so there is tachycardia, there is hypotension and tachycardia, but here patient is having hypotension and bradycardia. So there is loss of sympathetic tone. Can you tell me which shock? First person to reply correctly, which type of shock, guys? Subdeep Singh, Shalu Priya, very good, Shalu Priya, it is neurogenic shock. So it is neurogenic shock, neurogenic shock. So guys, it is neurogenic shock, clear? Next, instrument used for harvesting skin graft, all of you know it is Humvee knife, Humvee knife. And let me tell you guys, there will be one question related to either cannula, color coding of cannula, or Foley's catheter color coding. So 20 gauge IV cannula, this is pink, 20 is pink, and most commonly, yes, pink 20, and green is 18. So 20 gauge IV cannula, guys, it is pink, right? Very good, it is pink. And we are expecting one question related to Foley's catheter. What is the most commonly used Foley's catheter in males? In males, it is 16 French. Can you tell me the color? Males 16 French, and in females, it is 14 French. So males 15 French, 16 French, females 14 French. So what is the color? 16 French is orange, it's orange, and 14 French, guys, 14 French is green, 14 French is green, it's green. So guys, I am going to remind you again, there is another question which we are expecting related to trauma. Let me tell you the questions. There will be questions related to primary survey A, B, C, D, E. One thing I told you, in which cases you have to go for airway management. Second, tension pneumothorax. These are two important topics. Third, GCS, 100% chances are there that you are going to get a question related to GCS. So these are the important questions of trauma. One question will be there related to head injury, either EDH or SDH, and all of you know NEET findings of EDH, SDH. Sometimes they ask subarachnoid hemorrhage. Fast is important. Yes, splenic trauma, liver trauma, these are important. So these are important questions related to trauma. So these are important topics, guys. I hope your preparation is going on with full speed, right? Don't wait for anything, guys. You are preparing for FMGE, exam is on 29th, you have sufficient amount of time. Solve MCQs, give GTs, GTs are important, कोई फर्क नहीं पड़ता आपका स्कोर आ रहा है नहीं आ रहा है, प्रैक्टिस के लिए, अदरवाइज यू विल बी एग्जॉस्टेड इन एग्जाम. सो प्रैक्टिस GT एक इन वन गो ओनली विथ वॉच, यू हैव टू प्रैक्टिस इट. और जो नीट PG के लिए प्रिपेयर करें, गाइज यू आर हार्डली हैविंग 15 days, so think that exam is on 15th. Don't think about postponement, पूरा तैयारी कर लीजिए. If it is going to be postponed, obviously you will be having extra time. So guys, your preparation is up to the mark. Keep working hard. Good luck from the whole family of PrepLadder. All the best. Okay, yes, it's 26 July. Right. Okay, thanks guys. Thank you very much.